I'm Jocelyn, and I am going to start my postpartum assessment. I did my hand washing, and I'm going to put on some new gloves. Let me just move my stuff over here. Okay, so for this is going to be the head. Here's the body, and this will be the legs of said mother. So first thing that I would do after hand hygiene and washing my hands is I'm going to be like very compassionate when I go in the room. So I'm going to introduce myself to the mother. I'm going to go ahead and ask her how she's doing, how she's feeling, you know, if she has any pain. So I'm going to go ahead and be like, I'm Jocelyn, I'm going to be your nurse. Can you tell me about how you're feeling? Do you have any pain anywhere? You know, just kind of making them feel comfortable because they did just have a baby. So after I ask about how they're feeling, if there's any pain, I'm going to ask them to tell me about their baby. So, you know, how's baby doing, and do you have a name picked out? And I'm sure you have plenty of emotions going through your mind. You know, reassuring, asking about the baby, and things like that. After I get, so when you're first talking to them about the baby, about themselves, you can kind of gather a little bit of their emotions, how they're feeling. You know, they're probably going to be really emotional, like crying, or you know, just a little bit extra happy, sad, angry, frustrated, things like that. It's very normal when you first give birth to a baby, so you can kind of examine their psyche just a little bit when you first do that. So I'm just going to kind of get an idea of how they're feeling, how they talk about their baby, you know, the connection and things like that, that they have the shift of the focus to the baby. And so after that, I'm going to get my set of vitals first. So normally I would have a vital sign machine, but they could maybe, you know, do like blood pressure and things like that. But for this purpose, I'm going to go ahead and get the pulse first. So I'm going to go ahead and get her pulse. So I would just be kind of listening, getting her radial pulse, and then maybe getting the apical heartbeat as well. But I am going to go ahead and listen to the respiratory sounds of the mother. So I'm going to listen here to their lung sounds. While I'm here, I could listen to the heart sounds, all 5 spaces. So it's going to be the aortic, the pulmonary, Erb's point, tricuspid, and mitral valve. That's where the apical pulse is. So I'm going to make sure that's all sounding good. I'm going to go ahead and take an oral temperature for the mother to make sure that there's nothing going on there. I'm going to go ahead and listen to the lung sounds in the back as well. So if this was a mother, of course I'd have side rails up, and I would be listening to the back, to the lung sounds. You know, also still listening to the heartbeat. And while I'm listening to their lung sounds on the back, I am going to check for CVA tenderness, which is what I would do is if they were sitting up here, I would put a fist, I can't really hold it up like that, but right where their kidneys would be, which would be here. If they were standing up, it would be right here. So I would put a fist, or I would put a hand here, and I would hit it. You feel any pain? And then around the other side where the other kidney should be, you feel any pain? And hopefully they'll say no, there's no issues there. I did forget to listen. So first of all, before I had flipped her over, I would have listened to her bowel sounds. I'm not putting the stethoscope all the way in my ear because I have the earphone here, but I would listen to the bowel sounds here. I'm going to make sure all that's going in all 4 quadrants. And that is what I would use my stethoscope for. So for the next part of the assessment, I'm going to be following something called bubble he, which I'm going to be inspecting from the top of the mother to the bottom. So I'm going to start with the breast. So here, I would kind of ask the mother just a little bit about their breast, you know, if they're maybe hurting, do they have any tenderness, any cracking and bleeding. I want to make sure that there's, I want to check to see if they're soft, like normal breast tissue, or if they're filling up with the milk so that they can breastfeed. And I want to make sure that there's no red spots, no open spots. And here, while I'm inspecting, I could ask about nursing, you know, maybe ask the mom about how their baby's feeding, if they're able to latch on correctly, you know, if it's a painful, because it shouldn't be super painful for them to breastfeed, and just kind of, you know, ask about how they're doing with that. And then after that, I would move down to the uterus, which would be right about here. This is their stomach abdomen area on my pillow. With the umbilicus, I want the fundus, or I'm sorry, with the uterus, I want the fundus to be where the uterus is at. I want the fundus to be where the belly button is at. So after birth, the fundus is going to be about 1 centimeter or 1 inch above the umbilicus, which is normal. But so I'm going to go ahead and place my hand here at the symphysis, because I do not want to cause any issues with pushing the uterus down and causing further damage or causing the uterus to come out. So I want to be feeling it, not super hard, but I want to feel it. I should be able to feel it. It shouldn't be boggy. It also shouldn't be up and to the right, because that would mean that the bladder is full, and you really don't want it to be there. You want it to be center here with the umbilicus, and you want to make sure that there's no problems there. So while you're looking here though, and you're kind of massaging the uterus and filling that out with your hand on the pubic, on the symphysis, you would want to make sure that you could kind of maybe pull down the blanket and look at their lochia. So you want to look at if there's blood clots coming out, because that would be an abnormal sign. So you want to look to see if their blood clots are coming out. You want to see if they're bleeding, and if they are bleeding, you want to know how much they're bleeding. You know, is it red, dark red? Is it pink? Does it have a foul odor, or is it normal and earthy, like a period blood kind of would be? You kind of just want to inspect that while you're looking at the uterus here. So after the uterus, you're going to go down to the bowels. So I already did listen to the bowel sounds. You know, you kind of just want to ask mom about her restroom. You know, before you give birth, you do have like a natural clean out of the system. So like diarrhea usually will clean out their system. So they might not poop immediately, but you do want to ask about that. You know, listen to bowel sounds, see if there's any type of distension or abnormality there. After bowels, you would ask about their bladder. So you kind of already know that after you did the uterus inspection. So like if the uterus was up and to the right, you would know that their bladder's full, that they haven't used the restroom. You would also want to verbally ask, you know, like, when's the last time you used the restroom? And you know, each time that they use the restroom, you really want to be measuring at least for the first 3 times to make sure that they're voiding, getting everything out of their bladder. So after their bladder, we're going to go back down to the lochia, which is just inspecting again. You can kind of do that, I guess, at the same time if you're able to. But you look at the color, the odor, the amount, consistency. You know, if there's a super foul odor, or there's a large amount of bleeding, you know that something is not right. I do want to mention that when you're, massaging the uterus, and if the clots do come out, that's a good thing because you don't want the clots to sit in there. But also clots are abnormal, and there shouldn't be an excessive amount of blood. There shouldn't be a foul odor or anything like that, because that could be indicative of an infection or further problems up here. You want to look for, I already said that, okay. So the next thing we're going to do is the episiotomy. So if they were having to get an incision done because the vaginal birth required it for them to be able to fully birth the baby, you would want to roll them over, and you can inspect the episiotomy site from the back because it's easier to see. So of course you just want to look for your normal signs of infection and problems. So you want to look for redness, you want to look for odor, drainage, swelling, discharge, wetness, all of that stuff, and kind of make sure that that's not infected or causing problems. And while you're here, you can also look for hemorrhoids because of all the straining and the pushing that they do during a vaginal birth. You want to make sure that you document if they have any type of hemorrhoids, because they are uncomfortable, and they are normal, but they're uncomfortable, and if you can help treat the pain and kind of get those taken care of early, that's a good thing. So after we've done the bubble heat, we've already listened to the heart sounds, all of that stuff. Now we're going to look at the skin of the mother. So there are a few things that happen with pregnant women. Sometimes they'll have the pregnancy mask, which is just like the discoloration on their face here. It's not super common, but you will just kind of like look at their face there. And the other thing that is another pregnancy or postpartum discovery is the line on the belly, which is just like a dark line that goes down the center. So you kind of want to inspect to see if they have that, document that, make sure that that's not super aggressive or abnormal. You want to look at their stretch marks. That's the third thing. So they're usually going to have them here, maybe across their belly on the other side. So you just want to make sure that those aren't also super abnormal. They're usually going to be maybe light pinkish or silverish. But you kind of just want to inspect the skin there to make sure there's nothing wrong there. So after you look at their skin, you can maybe ask the mother if they've been sweating, if they've been draining, because that's all really an issue that can be there. So you want to ask them if they're sweating, because they have all kinds of IVs on them and stuff like that. They also retain a lot of fluids, so they're going to be very swollen. They're going to have all kinds of signs like that. It might be a little swollen and sweaty. So you just want to ask them how they're doing, if they've been sweating abnormally and things like that. So after, I totally just realized that I definitely did not finish my bubble he. So after the incision site, which is the episiotomy site and stuff like that, we're going to go down to the he, which is going to be the Homan sign, which is further down in the legs. So here we would look for signs of a DVT. So we kind of feel for calf pain, look for tenderness, swelling. You can maybe even measure the calves if you want to see if they're symmetric or not. You want to check their reflexes. So the first one would be, we would have the grab underneath the mother's knee, totally dead weight. They cannot help you, and you would have your reflex here, and you want to make sure that the foot at the bottom of the mother does a smooth flexion. If there's an issue, there will be kind of like a flexion that's not super smooth, and so you would want to document that and make sure that's not happening. So that's the Homan sign. So you want to just make sure that there's no clotting issues or abnormal swelling. They will have edema because they just gave birth. They had a lot of fluids going through them. So their feet might be a little swollen and things like that. But you would also just make sure that there's no type of abnormality with circulation or anything like that. You want to make sure that they're getting adequate blood flow, that there's no signs of something wrong there. So the last part of bubble heat is going to be the emotion, which I was talking about at the beginning of the video. You can kind of see that with their, when you're first talking to them. So you just want to check their psych, see how they're feeling about their baby. Are they getting that connection there? Do they make eye contact with their baby? Do they want to hold their baby? Do they do the skin on skin contact? Make sure that they're emotionally stable for the baby, how they interact with the baby, even if they have a spouse or a significant other or a supportive family member, kind of how their dynamic within the little family is. You would kind of want to give education, obviously. You want to educate them, so when they go home after having their baby, you kind of want to tell them to kind of be careful and watch for signs of postpartum depression. So, you know, in a few weeks after they go home, are they able to take care of their baby? Do they take showers? Do they take care of themselves? Do they feel emotionally connected to the baby? And just overall, are they able to take care of themselves and their baby, and how is the environment and the family dynamic? So that's kind of what you want to educate them on. So if they are feeling like they can't take care of their child, or there's issues there, you would want to tell them to contact their healthcare provider. And with that, I believe that concludes the postpartum assessment, but I'm going to look at my cards here and see if I missed anything. I did kind of go out of order, but that's because I got a little bit scatterbrained, but hopefully I went over it all. And I think that's it. Yeah. All right, thank you.